in season wise the program changes. So there are so many national health programs, yet we have the same number of healthcare workers, and we do expect them to be competent in all of them, and we do expect accountability from them. To explain the disparity between competency and accountability, I would like to just focus on one example. Previously there was MCTS portal, in which the A&M was supposed to enter details of every delivery and every delivery that was performed, details of every delivery from her area that did happen and that did not happen, or if there was any miscarriage or anything, into an online portal. And this MCTS was later revisited and converted into RCH portal, which was extensive, a book full of information of that particular woman from adolescent to 39 years, from that A&M's area of 20,000 population or something like this. You have to first track all of them, get all of the information, and then enter it into the software that is the portal, online portal. How do I put my point of competency and accountability here is in this manner. An A&M is someone who has passed 10th 12th standard and did her 2 years of course from somewhere in the district or taluka place, and she preferably does that course in her own regional language. Like in Maharashtra, they do it in Marathi. They do have an option to do it in Marathi, so they do it there. These women come from low or not very privileged families. These women do their course, and these women are expected to do fill in all the details of their patients, of their mothers, from adolescents to 39 years, in an online portal. Like, they are assumed to be competent. Of course they are given training, it's not that they are not given training, but a day's training, I think, should be revisited. This thought should be revisited, and a day's training is enough for them to understand and carry out. I highly doubt that, because I have seen them struggle with that. And then there is also issue of logistics, like the number of computers that are available for them to use and the number of computers with internet connection. I have a funny experience to share. In my area of where I worked, there were no enough computers, and neither were there computers with internet connections. So what was advised by the authorities was, go to a cyber cafe, do your work out of hours, like fill in the details out of hours, and then claim for a refund. But is this just? Is not the system responsible to provide a sufficient number of computers with working internet connections? And moreover, are these nurses competent to fill in details in a complex software and complex online portal on their own? And guess what? These portals are directly accessible from district and state and on from the PMO office. So you depend on a woman, a lady who is not very competent in computers, to fill in details, each detail in the right box, and then you assess her from the state and PMO office. Like, it's like you are depending on her so much, but you're not investing in her. You're calling her competent, you're training her for a day, and but you're asking her to be accountable for the data which will be reflected in the PM office. Like, how smart this is, I don't know. I doubt this. This is just a single example, but there are various things, various programs in which, and various real life situations where these healthcare workers are assumed to be competent, and then they are very, very, very meticulously checked upon to be accountable for that. And that is really a pain, because I have been with these healthcare workers, and they have come to me, they have cried in front of me. I literally don't want to say this, but they have their own personal lives, they have their family lives, they have their own being, and upon that, you ask them to work out of hour, you ask them to go to cyber cafes, you give them targets, you give them everything that comes in your mind as a boss to get things done, because you have your target to meet. And I think this is a major challenge that they face there. Apart from this, all this lines up is my final point, that is ritualistic exploitation. Yeah, all this lines up to to one thing, that is to be to these nurses to be exploited, to be this healthcare workers to be exploited ritualistically. It has become a habit, it has become a habit, and no one even cares for if they are competent or accountable for that, but they are exploited for that. I was a part of maternal death review committee, a district quality assurance committee which assesses every maternal death that happens in a government institute in a district. I was a member of it, and I have seen many nurses